Welcome to today's press briefing on updates of COVID-19 cases. We have with us Professor Sophia Chan, Secretary for Food and Health, Ms. Irene Young, Director of Food and Environmental Hygiene, Director of Health Dr. Ronald Lam, and Dr. Albert Out, Principal Medical and Health Officer of the Communicable Disease Branch of the CHP, and Dr. Larry Lee, Chief Manager of the Hospital Authority. We'll first hear from Professor Chan before we hear from Dr. Lam on details of epidemic situation, and Dr. Larry Lee will talk about treatment, and other speakers will talk about different areas, and Dr. Lee will talk about the situation of the Hospital Authority. We'll first hear from Professor Chan. Good afternoon, everyone. Since the 21st of April all the way to the 19th of May, we have seen relaxation of social distancing measures on two phases. All catering businesses and scheduled premises have now been allowed to open. We have seen restart of social as well as economic activities. We see more and more people moving about. The daily number of cases in Hong Kong has seen an increase. This is a rebound in the fifth wave. Yesterday, that is the 13th of May, we have recorded 737 cases. Shortly afterwards, Dr. Au will give you an update of the latest figures. With this increasing trend, we think that within this month, the number of new cases may reach a four-digit figure. Of course, we will continue to assess the overall situation. In light of the development of the epidemic situation, we have resumed case and contact tracing work in May. When we find that there are high-risk premises or there are outbreaks at certain locations, we will issue CTN, compulsory testing notice, or arrange for close contacts to go to quarantine. Given the number of cases having increased, we have strengthened the manpower of the contact tracing office. We will, as necessary, increase resources to the office in order to allay the risk of a rebound. We also aim to reduce the need to change significantly our anti-epidemic measures. You'll hear from the Director of Health about the latest assessment of the epidemic situation. The government continues to monitor the percentages of hospital admission, serious cases, as well as death. With an increasing vaccination rate in Hong Kong, coupled with an increased number of people who have immunity as a result of infection, these indicators are quite stable. As at the 13th of June, there are 371 confirmed patients being admitted. There are 15 people who are in a critical condition and 7 people in a serious condition. So far, there are 3 people staying in the ICU for treatment. In the past week, 4 COVID patients passed away. Compared to the last week, the number is similar. Regarding elderly people, including those staying in care home for the elderly, the number of infection cases and admission has not increased. That number stays at a low level. Our assessment of the current situation is cautiously optimistic. We are very cautious. We will monitor the latest situation and changes in order to guard against any rebound. For percentage of serious cases and admission, latest figure of cases, I will defer to Dr. Tony Koh, the Chief Executive of the Hospital Authority. The Chief Executive announced on the 7th of June that the government will closely monitor the development of the epidemic. There will not be the implementation of relaxation of restrictions in the third phase within this month. We have seen clusters appearing in pubs and bars. Law enforcement agencies have found incompliance in the form of incompliance of the anti-epidemic requirements by customers as well as persons in charge. This is a cause for concern. In view of this, we will, under the Prevention and Control of Disease Ordinance, gazette that in the next 14-day cycle, we will more or less extend current social distancing measures. However, we will impose an additional requirement on bars and pubs as well as clubs and nightclubs that customers before entering these premises will have to show a negative RAT result done within 24 hours. Otherwise, they are not allowed to enter. The effective date of this measure will be between the 16th and the 29th of June. This is to better control transmission risk. We will continue to enhance our inspections of various establishments because we have seen incompliances in these places. We require persons in charge to meet all these requirements. Since the beginning of June, our law enforcement agencies have inspected thousands of eating establishments, including bars and pubs and other establishments. Prosecution actions have been initiated against incompliances. There are bars and pubs that are required to close their premises for 14 days after they have broken the regulation. I now seriously appeal to you all to abide by all applicable anti-epidemic measures, including the use of valid vaccine passes as well as the use of Leave Home Safe app. We should work together to bolster the anti-epidemic capacity of our community in order to protect public health. In this regard, I will defer to the Director of Food and Environmental Hygiene for details. The government will be most serious in the tackle of the epidemic. Our aim is to reduce deaths, serious cases, as well as infection. We've also identified key groups of people, organization, and premises. We accord priority on the protection of the elderly as well as the young. COVID vaccination has been proved to be effective against serious cases and deaths. This is most obvious in the fifth wave. So I appeal to you all once again that elderly and young people should get vaccinated. Those above the age of 60 should get the 4th dose. I understand there may be cases when information was not transparent, but I ask those above the age of 60 to receive the 4th dose. The Joint Scientific Committee issued the same advice. Apart from vaccination, of course, regular RAT or PCR tests should be done as well. In this regard, the government offers free RAT or PCR tests for the elderly. We want to achieve early identification of cases as well as early isolation. We now have effective COVID oral medication, so wherever applicable, you will be prescribed with COVID-19 medication for treatment. We have drawn reference from our experience in the fifth wave. Care homes and nursing homes have been listed as key organizations. Starting from early May, we have, by phases, put in place PCR tests for those staying in care homes and nursing homes. That is, apart from RAT, we've also done tests for all residents in care homes and nursing homes. That is the same for staff members as well. Staff members working at these homes will have to do RAT every day or PCR regularly. We aim to identify silent or hidden carriers so that we can have early identification, isolation, and treatment. When there are hidden transmissions in the community, we need to protect our elderly people better, especially those staying in homes. For close to 800 homes, we have conducted tests on over 18,900 residents. These are PCR tests. We've identified about 90 or so cases that are repositive cases without any risk of transmission. We have not identified any new cases, but still, we will continue to monitor the situation. We will continue with our testing work. We will also arrange for outreach services. On top of that, the hospital authority will prescribe COVID-19 oral medication so that those staying in nursing homes and care homes will be better protected. This will also bolster our efforts to fight against the epidemic.
In relation to schools, which you are probably concerned, the CHP has, starting from mid-May, investigated 10 schools that experienced an outbreak in school, and the CHP has asked these classes and activities to be suspended, and there are some schools that voluntarily suspended classes for 3 days. After suspension of the face-to-face or in-person classes and activities for a short period of time, they have restarted their activities. We haven't found any transmission in these schools, and the clusters involved a couple of cases without any serious cases. Most of the students and teaching staff who were infected experienced asymptomatic transmission, and under these circumstances, the government will not be asking the schools to suspend in-person classes. The CHP, upon receipt of reported cases, will conduct epidemiological investigation and contact tracing and ask for certain classes of in-person classes or activities to be suspended. We will monitor the situation there. In terms of isolation, the fifth wave started towards the end of last year, and since then we have implemented the tiered triage system to handle the isolation of local positive COVID cases. We've also arranged for the positive patients and household close contacts to undergo quarantine at home or at designated facilities. In order to guard against the mutant subvariant, if the government has identified or has discovered that certain positive patients have to share the bedroom and the toilet, then we'll arrange for them to be isolated at designated facilities. And this is terribly important because this is intended to safeguard the health of the infected people and their family members. Given the increase in the number of cases, we will implement these measures. and where necessary, we will be reopen some of the community isolation facilities. July 1st is upon us. The Hong Kong SL government will see the important milestone of the 25th anniversary. We will be celebrating this event, and we hope that the members of the public will be enjoying this joyous occasion against the background of receding pandemic. We need the cooperation of the members of the public. The members of the public should observe the anti-epidemic protocol, and they also have to get the vaccination. All these are very important at this critical juncture. And I urge the community to come together to do their bit to combat the pandemic and make their contribution in fighting the pandemic. Dr. Lam, please. Friends of the media, fellow citizens, in June, we have seen an increase in the number of COVID positive cases, and we've seen more and more clusters, and they are growing. Some of the positive patients are suffering from BA.2, 0.12, 0.1, and some are related to the imported cases of BA.4 and BA.5. Now, by way of some comparison, we have 851 cases. That's the highest number recently, and compared with 443, we have seen an increase of about 50%. And in the community testing center and the mobile specimen collection center this week, compared with last week, the number of positive cases has also gone up this week on average. We have 0.53% of positive rate. Last week it was 0.29%. That's more like double. In terms of the infection clusters, they are growing, and there are also cases of unknown source that involve the sub-variant of Omicron, and the presence of these chains of transmission is causing quite a bit of cases in some blocks of flats. Some are vertically transmitted, some are horizontally transmitted, some are scattered. And for certain premises, like the bar clusters, we've seen quite a lot of cases. Since the reopening of the bars, we have recorded 6 clusters involving 350 cases. The largest cluster, the infection rate is like 22%. In these premises, the risk is pretty high because of certain reasons. First, people have their mask off for an extended period of time in these premises, and also in these premises they are more confined, and there is a higher risk of exposure in these circumstances. And also there are patrons who will be patronizing various premises in the same night, and if they are not taking sufficient precaution, there is a risk of transmission, causing second or third generation transmission. As the Secretary mentioned, she mentioned the situation about schools. I don't propose to repeat that. For care homes, the situation remains stable. We haven't seen any large-scale outbreaks. But from the indicators, we see that the number is increasing. The sewage surveillance, if we take the average 60,000 copies per person compared with previous copies, we have seen a drastic increase. RTDs if we compare last week with the earlier week, last week it was 0.55%. The previous week it was 0.49% in terms of the testing. The University of Hong Kong is also conducting two tracking exercises. The first one is the point prevalence percentage. The number is also increasing. The second one is the real-time effective reproductive rate. This is hitting 2.057 with one COVID-positive patient. He or she can infect two people. Now, there may be fluctuation, but the trend is actually going up. Now, there are four risk factors. The first one is the increasing social activities with more mobility, more people out and about. The transmission of the virus is likely in the absence of any protection measures or in the absence of sufficient vaccine coverage. The second risk factor is among these infection clusters, we are witnessing the Omicron subvariants like BA.2, 0.12.1, and BA.4 or BA.5. Overseas evidence shows that there is high transmissibility, and the immune escape is also higher than the other subvariants. The third risk factor is despite the fifth wave, the fifth wave is not over yet, and we're seeing a bit of a rebound, and there is a large proportion of people, about 1 million people, who have never been infected. And if the vaccine coverage is not high enough, there is a likelihood of infection. The fourth factor is that for certain groups, like 3 to 4-year-olds, the second dose rate is 45%. 5 to 11-year-olds, the second dose is only 49% coverage. And we'd like to achieve a rate of 90%. This is still a bit away from that. Now, for elderly people, for the first and second doses, the coverage has already gone up, but for the third dose, it is something like 18%. So we urge the members of the public in these or in Hong Kong to get vaccinated as soon as possible if you have already not already done so, in order to keep down the risk of transmission in the community. The Secretary mentioned some of the measures, and we will pay particular attention to the subvariant, and we urge people to take sufficient precaution. So we have the 5-tier triage systems for those who are asymptomatic, for those who are experiencing lower risk. But if they have to share the facilities at home, then we'll have a look at the infected people in this situation and see whether we need to quarantine or isolate them in designated facilities in order to minimize the risk of transmission in the community. We urge the members of the public to remain vigilant. They have to observe all the anti-epidemic protocol. They have to maintain proper hygiene, keep the mask on, and social distance at all times. And if they haven't got vaccinated, they should get vaccinated as soon as possible. Thank you very much.
Let's hear from Dr. Koh. Good afternoon, everyone. As you can see, that the number of positive cases, in particular this week, we've seen a marked increase. In terms of public hospitals, we have seen a stable number of admissions. In the past few days, those who are receiving treatment, the number of COVID patients is about 400. Most of their conditions are stable, and they are either asymptomatic or with mild symptoms. they might be staying in a hospital, but it's more because of their chronic illnesses. And of these patients, those who are in a critical condition or serious condition, the percentage is about 20%. It is a stable figure. I believe that is attributable to the high vaccination rate as well as the extensive use of antiviral medication. From Hong Kong experience as well as overseas literature, that's very effective in reducing fatalities as well as serious cases. The number of cases of serious and admissions are stable, but we will not let our guard down. We'll closely monitor the situation. As the director said, there are signs that there may be a rebound. Should there be a huge number of patients coming to the hospital, we will be prepared. We have already put in place contingency plans to start the commissioning of a large number of wards. We have earmarked hundreds of isolation beds for the use of patients in need. We also have contingency plans to enable us to commission another hundreds of beds within a very short time so that there will always be surplus beds. If necessary, we will be able to mobilize sufficient manpower to recommission the isolation facilities at Asia World Expo as well as the facilities at North Lantau. That's something that we have already done. This is for the eventuality that there will always be facilities and services waiting for patients. We have also enhanced our emergency level. We have set up a new command center. Should there be a huge number of cases of public health situations, we will be able to give directions and make plans within a very short time. We will also be able to mobilize resources in terms of beds as well as manpower within very short time, and we are also able to consolidate the 7 clusters into one so that we can react timely. Apart from that, we have also enhanced our capabilities in terms of equipment and machinery. We have procured over 1,000 pieces of machines that would generate oxygen as well as relevant equipment, and this enhances our capabilities to treat people with breathing problems. At the same time, we have increased our coverage and our ability to treat at different hospital authority premises, say for example outpatient clinics and emergency departments. We have put in place plans to prescribe suitable drugs. At the same time, at isolation facilities, care homes for the elderly and people with disability, we have also started prescribing COVID-19 oral medication. We have over 300 doctors from the private sector to provide treatment, if necessary, to COVID patients. For resident doctors of care homes, we have also put in place medications for them to use should the need arise. There may be an increasing sign for the hospital authority and our public health system. The situation is stable, but we have everything in place to enable us to respond very swiftly. Let's hear from Ms. Young. Ms. Young, good afternoon. To abide by the requirements under the Prevention and Control of Disease Regulation is very important. The FEHD is one of the main agencies in the law enforcement action. We need to make sure that these measures are effectively implemented. We disseminate information to those involved. We have a dedicated webpage on vaccine passes under our purview. It gives the latest instructions in this regard. We also set out compliant mode of operation by catering businesses as well as scheduled premises. We've also provided all the notices and forms they need to fill. There is also a section of frequently asked questions. Another area is law enforcement. Our actions are continuing. Our key areas may be on dancing or live performances. We will also carry out inspections on air exchange per hour of these premises. We also check whether requirements of mask wearing at the table is abided by. On top of that, there is also vaccination tests requirements by staff members as well as those on customers, and checking of vaccine passes and Leave Home Safe app by customers. Starting from the 10th of June, the Secretary has issued new instructions on catering businesses and scheduled premises, requiring person in charge to maintain, operate, repair equipment relating to the supply of fresh air at these premises. Failure to do so carries a criminal liability. These premises will also, in addition to that, put in place measures to prevent infection and transmission. These include maximum 2 people per table starting from the day after there has been any infection, and also after 6 p.m. There should not be any food and beverage supplied to be consumed at the premises, which these measures will last for 14 days. We vigorously mount inspections and law enforcement actions. You may notice that we frequently issue press releases to provide information about our actions. Between the 10th and the 12th, that is last weekend, using that as an example, we have mounted a joint operation with the police by carrying out inspections of 266 catering businesses, including 152 bars and pubs. We have also inspected 1,142 catering businesses, including 89 bars and pubs. Of this number, there are 28 bars and pubs as well as 10 eating as catering businesses that have breached the relevant regulations. We have initiated prosecution action. Failure to comply with these requirements will attract criminal liability, and persons in charge will have to make sure that all the requirements will abide by all these requirements. That is, those under Cap 599. Observance of relevant regulations will safeguard public health. Please do not break the law.
Dr. Au will bring us up to date on the cases. Let me bring you up to date on the latest regarding the COVID cases on the 13th of June. We have 752 local cases reported, including 348 confirmed by PCR tests, 404 self-declared RAT cases that have been verified, and there are 97 imported cases. Altogether, since the 5th wave, we have recorded 1.28 million cases. That there were 40 cases that were picked up at the airport, and 39 cases were picked up at the quarantine hotel during the quarantine period. And the remaining 18 are cases that are picked up from the community testing after day 7. We will be conducting the genome sequencing analysis to see whether they are imported cases or locally acquired cases. For deaths, yesterday there was 1 case of death. In total, since the 5th wave, we have recorded 9,178 deaths. There is a care home that experienced earlier cases that reported a case yesterday involving a carer. The person tested positive on the 12th of June, and there are 29 residents and 9 staff members who are close contacts that have to be quarantined. For schools, we have received a total of 134 positive cases, 103 students and 31 teaching staff members. And there are 112 schools that are involved. Of these, 45 saw 2 or more cases over the past 7 days. There are 5 more schools that saw some clusters in different classes. We have advised that these classes have to be suspended until the end of the week, and they are 香島華德福學校 and 西貢李兆欽學校 and 元朗Public School, 迦南學校 and St. Peter's Church Kindergarten. The island school that we announced yesterday in Pok Hong Estate, there were teaching staff members who were infected, and there are 2 more cases in this school in total. Since the meeting on the 8th, there are 8 cases, and all the other participants in the meeting are close contacts. They have to observe home quarantine. For new clusters in Wan Chai, Queens Road Central 202, QRE Square, Hong Kong Funky Dance Center on June 7th between 7 p.m. and 9 p.m. In one of the classes, there are 6 people who tested positive, and in this particular class, there is a teacher who tested positive. There are 7 cases from this cluster, and we will issue CTNs to this center. Those who have been to this place at designated time will have to undergo testing. For the earlier cases, Rack City, there is 1 more patron who tested positive, taking the number to 22. All of them are patrons. And FLM, there are 4 more cases today, 3 patrons and 1 staff member, taking the total at FLM to 28 cases. 25 involving patients and 3 staff members. In terms of genome sequencing, there are 25 cases that are suspected to be BA.2, .12.1, and there are cases with epidemiological link. Of these 25 cases, 10 are of unknown sources. 11 are epidemiological link with these 10 unknown cases, including the family members and also the occupants in the same block. And they are on the Belchers, Blocks Tower 6 and Kwun Long House, Block F, Tai Ku Sheng Kosan Mansion, Longshan Mansion, Healthy Garden, Block F, Lok Fu Estate, Wang Lok House, Cheng Heng Building, Ao Tau Kok Lower Estate, Block 3, Fook Wing Street, number 24, Sun Wing Building, and Cheung Guan O, Lower Park, and the other one is in Sai Kung Hee Ming Yuen. There are 3 cases that are residing in buildings with earlier cases. Wheelchair Station will house 1 case in Kwun Tak Estate, Kwun Chang Court in Ho Man Tin, and Warming Estate Warfight Court in Zhangguanou. There are cases involving a building site in Fat Kwong Street, and there is one more case today, taking the total number of cases in this building site to 4 in total. Our investigation shows that they are using the same common room in a container box, that they will be having meals there. There are other people who will be using this changing room. They're all listed as close contacts. They have to home quarantine. For BA.4, BA.5, there is one more case. In fact, yesterday, we talked about the Regalia Sky City Hotel, 39-year-old female staff member. We announced this yesterday, and from the genome sequencing, and this is a BA.5 or BA.4 case. Now, our genome sequencing shows that this is, in fact, a BA.5 case. Dr. Lee, please. We have 391 patients in hospital. 76 are new patients. Of those in isolation facilities, 114 are first tier room, 11 second tier room, 54 in North Atlanta Hospital ICC. There are 50 newly admitted patients. There's one patient who is in critical condition. He's got 2 doses, and there is one in serious condition with 2 doses. Of those hospitalized, 15 in critical condition, 8 in serious condition. Of the 2 critical patients, 2 are in ICU. There are 9-year-old male who passed away, not from a care home, with 2 doses. He is suffering from artery fibrillation and heart failure. On June 3rd, he turned up at the A&E of PYNEH. He suffered from a fall, and from X-ray, he suffered from a dilated heart and some infection. Upon admission to the hospital, he tested positive, CT value pretty high, about 40. And also we found that other than some heart conditions, he's suffering from some renal problems. His potassium has risen, and there are problems with urination. Now, all his organs are declining. On June 13th, he passed away, and we don't believe that there is any connection with COVID. There are 55 patients who have recovered. 47 have been discharged since the 5th wave. 59,967 have recovered. 30,570 have been discharged. Since 2020, 63,340 have recovered. 62,950 have been discharged. One is picked up upon admission screening. 3 are listed as close contacts. 23,737 staff members have come down with COVID, and 23,652 have returned to their posts.
Yesterday, we reported about a psychiatric ward in United Christian Hospital. There are altogether 6 people involved. They have attended the same gathering as well as had meals together. They've been previously classified as close contacts. The other 21 close contacts have completed their PCR tests. They are all negative. We'll continue to monitor the condition of our staff members, and we'll keep you updated. We will also make use of our newsletters across the different clusters to remind everyone that they should avoid eating together. This is not satisfactory, especially when a group of staff members had a photo taken with their masks off. We expected more, and we hope that our staff members will be a good example in the epidemic situation, that they should avoid gathering and eating together. Let me remind all staff members of the HA that they should refrain from eating together, and when they attend meal gatherings, that they should keep their masks on, stay socially distanced, and abide by all the relevant regulations and restrictions in order to reduce the risk. Thank you. Now the floor is open for questions. Please make use of the microphone we give you and keep your questions to under 2. Identify your media outlet before you speak. The one in blue, the gentleman. I'm from AM 730. In relation to the social distancing measures, you said they will be extended by 14 days. For the next cycle, will it be extended over to the next term of government? What's the discussion with the CE-elect's office? In relation to isolation facilities, well, do you have a timetable of restarting the use of community isolation facilities? Those family members of infected persons, they may stay at home. Will that change? Will there be tightening of restrictions as number of cases increase? Well, in relation to some measures, will that also end at the end of the month? First, regarding the extension of social distancing measures in the next 14-day cycle, we will more or less extend these existing measures, but there is an additional condition that customers, before entering pubs and bars as well as clubs and nightclubs, will have to produce RAT negative results done within 24 hours. This measure will be put in place between the 16th and the 29th of June, and that is the 14-day cycle. Regarding the cycle after that, as the Chief Executive said this morning, we are having a discussion with the CE-elect's office. We have given them a risk assessment. When it comes to the time of the next extension, a decision will be made. Your second question is in relation to community isolation facilities and the restart of the use of such facilities. Should the situation becomes critical, we don't rule the possibility of restarting the use of these facilities. We already have facilities built with the help of the central authorities. We have isolation and quarantine facilities being used at the moment, that is the facilities at Penny's Bay. We have sufficient capacity. We've also made plans. We've made plans for the next wave. In terms of manpower on management, operation, and cleaning services, as well as healthcare, we already have the plans. If there is an exponential increase of number of cases requiring us to use these facilities, we may consider using the standby facilities again. But it's not that time yet. We are still using the Penny's Bay facilities as well as home quarantine and isolation. We have the multi-tiered triage and treatment strategy. For those in a critical or a serious condition, of course, they'll be sent to hospitals. Those with mild symptoms or without any symptoms, they may stay at home if their domestic setting is appropriate. By that, I mean there should not be any shared use of bedrooms and bathrooms, because there will be risks, as you've heard from the director, that we've seen cases of vertical or horizontal transmission. We need to protect members of the public. So we have risk assessment as well as multi-tiered triage and treatment strategy. In relation to the daily RAT of school students as well as teaching staff, we think that that's a very effective tool. This gives us a better picture of the overall situation. When reports are made to us, that means the student tested positive will not go to school, and there will not be transmission from the infected student. But there are still potential risks as well as the incubation period. The Center for Health Protection will start contact tracing and epidemiological investigation when there is an infected case. We'll also ask the school to suspend that class. The school will be thoroughly disinfected. For some schools, they may choose to suspend classes for the whole school for a few days. The CHP closely monitor the situation and the number of cases reported. Next question, the lady in the middle. I'm from Now TV. First, have you received any invitation to stay on to the next government? Will you assist in anti-epidemic measures? Will there be any measures or negotiations for any extensions of these measures? In relation to the new condition on bars and pubs, RAT tests by customers, how to prove it? A photograph? Are you concerned about false provision of information? How do you verify it? Will the bars be held liable? Well, how do you know whether the infected person share a bathroom with family members? And does an infected person have the right to choose not to be isolated at an isolation facility? We'll first hear from the Secretary and then Ms. Young before we hear from Dr. Lam. I will not answer any questions in relation to myself. For your second question, as you may be aware that there are signs of an increase in a number of our indicators. We've also noticed transmission chains in our community. Fortunately, in terms of number of deaths, admissions, as well as serious cases in our healthcare system, these numbers are stable. The hospital authority have plans in place and they will continue to monitor the situation. Considering the overall situation, we notice that there has been repeated breaching of our requirements by certain premises. That's not satisfactory. We allow certain premises to reopen. We relaxed these measures. We would like people's lives to get back to normal and economic activities to resume, but we require your cooperation and for these requirements to be met. Of course, we need to work harder to boost our vaccination rates, in particular the third and the fourth doses. We'll continue to make assessment of the situation. We'll continue to monitor the situation. We will not hesitate to handle any incompliances.
Starting from the 16th of June, for the 14-day cycle applicable to the nightclubs and bars and pubs. we require patrons to show negative RAT result within 24 hours before they are allowed into these premises. Now, for these RAT negative results, how should they be provided? Our idea is they have to show a photo showing the negative results, and they have to show the name, the date of test, and time on the photo. And at the present moment, this is applicable to the staff members in these bars and pubs. Whether they are recovered patients or whether they have the medical exemption or whether they have been inoculated, the staff members will have to undergo the RAT test before they go into these premises. This is nothing new for the staff members at all. There is a question about, under the law, how the patrons should be checked and what should the proprietors do. Like the compliance with other regulations, that they have to exercise their due diligence. The law enforcement agency would have regard to whether the patrons have been checked. Now they have to make sure that the patrons will have to fill out all the necessary information, and they have to provide the QR code verifying device to check the veracity of the record. And from the 16th onwards, for bars and pubs, they have to check the RAT test result, the negative result, within 24 hours on the part of the patrons. Whether there is any misrepresentation, the law enforcement agency will exercise their judgment. If the responsible person shows that they have already taken all reasonable measures to comply with the law, they don't have to be unduly worried about it. Dr. Lam. For the positive cases, we do have the MultiTier Triage treatment system to undergo risk assessment and risk control. If they self-declare the result, we will, on the basis of risk assessment, they're supposed to make available certain information. We will then judge whether they can isolate at home or whether they should be sent to designated facilities. Now, the information that would be required would be the household members, whether there are any high-risk people, like senior citizens above the age of 70, or children under the age of 5, or pregnant women 20 months into the pregnancy, or any other household members with high risk, and also whether they are suffering from any particular illnesses. We also have regard to the environmental assessment. Now, in this regard, we would see whether they have separate use of the toilet, whether they are having any shared use of the facilities. We would have regard to all this information, and also whether there is any risk that is present in the block of flats that they're residing in. And if there is any information which is unclear, we will pursue the information, and then we will decide whether they should isolate at home or in designated facilities. 2 questions each time, please. Lady in floral shirt. Ta Kung Pao. In June, we have about 7,000 positive cases. The Secretary said that the government will create the right condition for us to celebrate the July 1st event. Do you think that the anti-pandemic measures are too lax? What measures does the government have to make sure that there will not be any further outbreaks? will you be speeding up the efficiency of PCR tests? Like some of the test results will not become available until the next day, and people will be out for work already. There are some LegCo members who said that the school RAT test can stop cases making their way into schools. Are you going to be encouraging the large corporations to make the staff members undergo the RAT every 3 days? For example, Secretary, thanks very much for your question. First of all, our anti-pandemic measures and policies are basically the 3 reductions and 3 priorities, and these are the key policies that we adopt against the pandemic. Of course, we have to reduce infections in the community. We have to make sure that there will be less of a risk of infection, or we need to try our very best to sever the chains of transmission. And on this score, we are guarding against a rebound in the community every single day, where we implement the RTD. We also issue the CTNs. The contact tracing officers have also increased the manpower to contact trace and to identify the associated cases and quarantine and isolate the close contacts. As the number of cases increases, we have also increased the manpower for contact tracing correspondingly. And in terms of testing, there are 2 things. We do PCR tests on the one hand. We do have the mobile specimen collection centers, and we also have the community testing centers in the community to make it really convenient for the members of the public. And I mentioned the priorities. The first priority is the senior citizens. So we are distributing for free the RAT kits to the senior citizens at certain designated spots. We have so far distributed something like 10 billion RAT kits to the elderly folks, and they are coming forward to collect these kits every day. We urge them to undergo the RAT test because if they can discover the infection earlier, they will be treated sooner rather than later. The antivirals are very effective against COVID, as mentioned by Dr. Koh. In terms of PCR tests, other than the mobile specimen collection centers, we're also making the PCR tests available to the senior citizens for free. You mentioned whether the turnaround time can be faster. Now, the contractors are doing their best. In general, if the cases are not really overwhelming, the results would become available within 24 hours. Now, the RAT test is so common. If people are worried, after the PCR test, they can also undergo the RAT test. That would enable them to know about the results as soon as possible.
Our anti-epidemic measures are rather vigorous. We'll continue to monitor different indicators. Should there be any signs of an outbreak, we will monitor the situation. It's just like what Dr. Koh said, that we have contingency plans for hospital beds as well as dissemination of information and instructions. We have the manpower as well as manpower to tackle a rebound, and the response time will also be reduced. Of course, we need your help as well. That can be by way of testing, proper wearing of protective gear, we have relaxed social distancing measures. We understand that you have your everyday lives to get on with. When you go to catering businesses, you may take your mask off when you eat. You can shorten the time when your mask is off. We've also seen clusters, especially at bars and pubs. Well, when you take your mask off, the risk increases. So please abide by all the rules. And there is this new requirement. Please observe the requirement. Lastly is the vaccination. The current requirement of vaccine pass is 3 doses. 3 doses. So for those who are waiting to get their 3rd dose, please do so when it's the right time. Those above the age of 60, we recommend that they get 4 doses. We heard voices saying that they might want to wait for a new generation of vaccine which may be available at the end of the year. I will ask you not to wait, because in order to reduce deaths, serious cases, we ask you to get vaccinated as soon as possible. If you're waiting for the time to get your 2nd, 3rd, and 4th dose, please do so. And the gentleman in the 4th row.
From the South China Morning Post. So in your opening statement, you've said that you're very concerned about the current COVID situation in Hong Kong, and you've introduced a new policy for bars today. How do you square that with what experts have recently said about not being worried about Hong Kong's COVID situation and not thinking that there's a need to tighten COVID-19 rules, given, as you said, that several metrics such as hospitalization, severity, and death cases, or even sewage sampling have remained at a low level, which means the COVID-19 situation has not brought a huge impact to Hong Kong society right now. My second question is, given the policy you've introduced on bars, can you perhaps share with us what type of violations or like recent violations you've found in those premises, and any prosecutions that you've made? And also, how would you respond to the industry, for example, Alan Seaman, who said that the industry is being made a scapegoat, and the industry only represented a small fraction of COVID-19 cases in Hong Kong? Thank you.
Okay. May I invite Professor Chen to answer questions 1 and Ms. Yuan to answer the questions about the prosecution and enforcement actions?
Okay. Thank you. Thank you for your question. First of all, as I think our previous speakers have already alluded to, including our Director of Health, our Hospital Authority Chief Executive, has given you some data and also the most recent situation. And that is, on the one hand, we notice, and according to our surveillance, all the community surveillance type, or be it the testing positive rate, be it the sewage results, as well as our number of confirmed cases, has shown an increase. And that's quite clear. There is some form of rebound, from the 5th wave. And so therefore, it is important for us to not allow this spread to go wild. Because if this spread go wild, then, there is always a possibility of, going into our elderly community And this is our priority groups that we have to protect. As we learn from our previous experience of the fifth wave, that elderly is a priority group that we have to protect. And if you look at our vaccination rate of the elderly, especially for those who are over 80%, is still not as high as we have expected. So therefore, while our hospital data, in general, the situation seems stable in terms of the severe cases, the death rate, and so on. But on the other hand, we also have to be very careful about the spreading of the cases in the community. So therefore, we are trying to protect, people who are going into these places, for example, bars, pubs, that are really high risk because people are not wearing masks, probably, for a period of time, and people are socializing, etc. While these are normal behavior, but we are in the situation of an epidemic and pandemic. So therefore, I think some of these measures that we have that we have announced just now, for example, the RAT, doing RAT, having a negative RAT before going into the bars, is really to protect everybody, for all the bar goers and also the entire community situation. We are also going to strengthen our enforcement, step up our enforcement. And our director of the Environmental and Hygiene Department will tell you more about what are some of the violations that the bars have actually committed. These are some of the things that they have actually found together with the joint operation with the police in the situation where during their inspection. So these are real cases, and therefore we must do our best to stop this from happening so that it will not affect the rest of the community.
Our department, together with the police department, have indeed stepped up our enforcement actions over the past few weeks. In fact, we have been doing it all along, but then because of the upsurge in the number of cases of COVID-19, we have particularly stepped up our enforcement actions over the past few weeks. More specifically, our department and the police, over the past weekend, from the 10th of June to the 12th of June, we have inspected a total of 266 catering premises, including 152 bars and pubs and 9 other premises during the joint operations. Our department, on our own, has also inspected a total of 1,142 catering premises, including 89 bars and pubs and 392 other premises in all our districts. Our department has initiated procedures on prosecution against operators of 28 bars and pubs in Central, Western District, Wan Chai District, Eastern District, etc., as well as 10 other catering premises in various districts. The department has also required the premises to take corresponding measures for reducing the risk of transmission. 15 bars and pubs and 10 other catering premises found with irregularities had to, on the subsequent day of being identified of the irregularities by our enforcement officers, they have to cease selling or supplying food or drink for consumption on the premises from 6 p.m. onwards, and also restrict the number of persons per table to no more than 2 for a period of 3, 7, or 14 days, as the case may be. 13 bars and pubs found with irregularities had to, on the subsequent day of being identified of the irregularities by our enforcement officers, they actually have to close for 7 or 14 days. Our department has also issued fixed penalty notices to 15 staff suspected of breaching various rules. For example, the requirement of having a negative rapid antigen test record checking, and 7 customers suspected of breaching the cap on the number of persons per table, 2 staff suspected of breaching the mask wearing requirement, 1 staff suspected of breaching the vaccine pass requirement, and 1 customer suspected of breaching the requirement of scanning leave home safe manual QR code and vaccine pass requirement in bars and pubs. I'm telling you all these not because we want to prosecute people, but we want to impress upon people and appeal to the public that everyone must abide by the rules. This is the only way to make sure that we are in a health and safe and hygienic environment. Thank you.
好，我哋答得最後一條問題。嗰邊第三行白色。
Last question, the lady in white over there, please. HK01. A few moments ago, you announced the new measure of the negative IAT result within 24 hours for bars and pubs. In future, if we see an upsurge in the number of cases, like in other eateries, would you apply the same measure to other eateries as well? And also, the medical school study showed that 3 out of 4 recovered patients are suffering from long COVID. Do you think this would add to the healthcare burden going forward? Will you take into account the overseas experience to collate the information for the recovered patients so the people will be kept abreast of the long COVID issues? Secretary. Thank you very much for your question. This measure is intended to safeguard the members of the public, and this is also intended to safeguard the health of the bar or pub goers. This is also intended to safeguard the measures. All these are risk-based. We have to control and manage the risks properly. Dr. Lam, Director Lam, has already said that in the recent past, we've seen growing clusters in bars. We've seen growing number of cases to the tune of 300 or so people. Now, with this increasing trend, and as you heard from the director of FEHD, in their inspection, there are bars and pubs that have flouted the rules and regulations. We have to protect the whole society and the people of Hong Kong. As to whether these would be applicable to other premises, now as I said, we have to be risk-based in schools and in the elderly care homes and among the civil servants and among the hospital authority staff, and indeed in many organizations, people are undergoing the RAT test on a daily basis. With our RAT test, they would be able to find out about their health status, and this is also protecting themselves and other people. We're encouraging people to undergo the RAT test. Like I said, we are distributing the kits to the senior citizens for free. And we hope that with this orderly relaxation, we have to make sure that the relaxation is taking place with minimum risk. I defer to Dr. Koh about the long COVID, but let me say this. We will be paying attention to the data from around the world and also the latest information from the WHO. The Department of Health and my colleagues would pay particular attention to this. Also in Hong Kong, we've seen quite a large number of infected cases. And like you said, we will look at all the statistics, and we would support local studies on the issue of long COVID to see whether this is happening to the recovered patients in Hong Kong, and so what is the overall situation. We will support the studies in this regard. And third, we have already started the Chinese medicine treatment. Now, these already started in the previous waves, but in the fifth wave, we have seen a lot more positive patients. And in the 18 Chinese medicine training and research centers, we have increased the quota, albeit inhibited supply. Now we have the Chinese Medicine Development Fund, and this fund is supporting quite a lot of projects for the positive patients at the beginning. Now we're extending this to the recovered patients. Other than the 18 Chinese medicine training and research centers, we also have a lot of TCM practitioners who can undertake this kind of work as well. Dr. Koh? Right, in terms of long COVID, as the Secretary said earlier on, together with the academe and also the DH, we have been very concerned about the situation of the recovered patients. We are having regard to the literature from overseas and locally. Our observation is that there are different stages of COVID, and different people may have different situations, and I mean, the vaccination will also make a difference. In the medical world, there is a limited knowledge of the long COVID situation for Omicron recovered patients. The patients will need follow-up consultation at primary health care level. As I said, together with the DH and the universities, we are analyzing the data and closely monitor the situation. When patients turn up for follow-up consultation, we will offer the right treatment depending on their situation. Well, Dr. Koh mentioned the primary health care, and let me say this also. In the cases of long COVID, our primary health care system, the DHC, are offering different kinds of counseling and services to the long COVID patients. So, in this regard, other than the Chinese medicine, the district health centers also making available the services. That's the end of the press conference today. Thank you very much. Speaking, not speaking through. For bars and pubs, they do need to follow the requirements applicable to bars and pubs, and that is the negative RAT result within 24 hours.